Hi, this is an introduction to psychological disorders. And if you can see, psychological disorders comes in many forms, defined in many different ways. And if you see the images, it can appear in many different ways. In this video introduction to psychological disorders, our learning goals and objectives are: we're going to give a brief interview of the history of mental illness. We're going to try to understand the problems in defining the concept of psychological disorders. We're going to describe what is meant by harmful dysfunction. We're going to identify the formal criteria that thoughts, feelings, and behaviors must be considered abnormal and, thus, symptomatic of a psychological disorder. We're going to also describe the basic features of the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. And we're going to discuss the changes in the DSM over time. And this is really just a brief overview of what the chapter on psychological disorders are. Now, one definition of the definition of a psychological disorder is a condition characterized by abnormal thoughts, feelings, and behaviors. Psychopathology is the study of psychological disorders, and it also refers to the manifestation of a psychological disorder. And it is often conceptualized as inner experiences that are atypical meaning that something deviates from the norm, that it is something that is distressful, dysfunctional, and even dangerous as a sign of a disorder. How did mental illness begin? Well, this is going to be just a brief historical timeline. Certainly we cannot go through every historical change, but just some of the few of the changes of how the history of mental illness began. And of course it began in 1798 by a man named Felipe Pinel, who was considered one of the founders of psychiatry. And during this time, people, those who suffered from mental illnesses, they were often put in what was called insane asylums, and they treated them as prisoners, and they kept them out of the public image. And of course, he was one of the early advocates for the mentally ill, and he worked very hard to change the conditions in hospitals of how inhumanely people who suffered mental illnesses were taught or treated. When we think about the history of mental illness, we often think about Sigmund Freud. Now, you studied Sigmund Freud in chapter 1 on the introduction to psychology, and he had a huge influence on mental illness, and he was recognized for his theory of neurosis in the development of the DSM. And he also helped shape the development and inclusion of post-traumatic stress disorder in the third publication of the DSM. In 1946, the National Institute of Mental Health was started to help train people in the field of psychiatry and mental illness. And of course, in the pre-World War II era, unlike our current circumstances, organized psychiatry was not heard of and was not even known. And instead, psychiatry was much as it had been at the end of the 19th century. There was a limited profession who dealt directly with mental illness populations. And of course, in the World War II, this changed all of that. And of these changes continued even up to the year 2000. And of course, there has been like 50 years of psychiatric nomenclature, reflections of the 1943 War Department Technical Bulletin. As we fast forward into talking about the history of mental illness, we look at the publication in 1994, when the DSM-4, or the fourth publication of the manual, was published. Of course, Dr. Alan Francis was appointed by the APA, or the American Psychiatric Association, to start a comprehensive revision of the DSM. And he is also a critic of the DSM-5. All right, in the year 2000, the fourth publication of the DSM-4 was published. And of course, this was a text revision. And of course, diagnostic codes were changed to reflect updates in the ICD-9, meaning the International Classification of Disease, 9th edition. And of course, they wanted to maintain the current value of the DSM. And of course, this was published in the text revision in 2000. And the majority of the changes were to the descriptive text as opposed to the symptom list of the diagnosis. And in the DSM-4 was a multi-axial system of classifications. And of course, it provided for more clarity, had additional instructions for changes in different structures, sections. In 2013, there was a work group, 13 work groups, who worked for 10 years to change the DSM totally. And of course, it was published in May 2013, and there were many revisions made that we will discuss. Now, the changes from the DSM-4 to the DSM-5 was that it provided information about comorbidity, which is the co-occurrence of two disorders. The DSM-5 is also longer than the DSM-4, and it has many categories, which has specific symptoms that are required for diagnostic criteria. And it also shows a lifeline prevalence rate, the percentage of people in the population who develop disorder in their lifeline of various psychological disorders. And it, of course, provides for more information about comorbidity, as you can see in the Venn diagram. For example, a person who has an obsessive compulsive disorder may also have a major depressive disorder. And of course, here the percentage shows that 41% has both of these disorders. When we talk about psychological disorders, we look at many different cultural differences. And of course, in various cultures, the behavior varies. And what might be expected in one culture that is appropriate may not be appropriate in other cultures. For example, in the United States, it is expected that you smile or you return a smile when a stranger smiles, or that you speak when a stranger speaks to you. Of course, cultural expectations in Japan, people are very reserved, they show a lot of restraint, and they maintain privacy around strangers. People in Japan generally do not respond to smiles from strangers. Other examples include eye contact, which is considered rude in certain cultures, such as in Latin America, African, and Asian cultures. When we start talking about defining psychological disorders, we talk about it as being a harmful dysfunction. So how do we define harmful dysfunction? Well, it says that dysfunction occurs when there is an internal mechanism that breaks down and a person can no longer perform normally or function normally. And it must be harmful that it leads to a negative consequence for the individual or for other people, judged by the standards of that individual's culture, such as we have discussed previously. The harm must include significant internal anguish or problems in the person's day-to-day living. Now, the American Psychiatric Association came up with an official definition of a psychological disorder in 2013 when the fifth edition of the Diagnostic Manual was published. And according to the Psychiatric Association, certain conditions must appear in order to be diagnosed as having a psychological disorder. There must be significant disturbances in thoughts, feelings, and behaviors. The disturbances must reflect some kind of biological, psychological, or developmental dysfunction. The disturbances must lead to a significant distress or disturbance in a person's life, or the disturbances do not reflect expected or culturally approved responses to certain events, such as we discovered when we talked about cultural differences. So, how do you define the presence of a psychological disorder? Well, just because something is atypical or that it deviates from the norm, it does not necessarily mean that a person has a disorder. But if a person has hallucinations, he hears voices, or he feels extremely depressed to where he loses interest in activities, or he has difficulty eating or sleeping, or he feels just utterly worthless, or he contemplates suicide, then typically we can say that something is out of the norm or the ordinary for that individual. Why do we need a system of classification? Because it allows professionals to use the same language with others in the field and aids in communication about the disorder with the patient, colleagues, and the public. When everybody speaks the same language and communicates in the same manner, then we can diagnose with proper guides and provide successful treatment for the individual. And of course, we know that the classification system that is used by professionals is the DSM-5, which is the current publication that has undergone several changes and was published in 2013. And of course, the manual includes a total of 237 specific diagnosable disorders, which are described in detail, including symptoms, the prevalence, risk factors, and comorbidity. And of course, we define comorbidity as the co-occurrence of two or more disorders. This is just a brief overview of psychological disorders, and we will discuss more in detail the various disorders that are listed, the most commonly that are diagnosed. Following this video presentation, complete your 10-question multiple choice quiz.